Hello! Today's video we will be in a very unique video, and it will probably have sequels. Today we will have my dad, aka a psychiatrist. And today we talk about OCD, which stands for Obsessive Compulsive Disorder. Welcome to today's video. My dad is a relatively well-known consultant psychiatrist at Shifa International. He has been on Pakistani news from time to time on talk shows and has also been on a small podcast. Now to define OCD. First of all, phrases like he's an obsessive video game fan or she's a compulsive liar are not OCD, even though we use obsessive and compulsive a lot of the time in daily sentences. However, when thoughts that stress you out happen again and again, or you experience the urge to do things over and over again, that's when these things could become a problem or possible symptoms of OCD. Without further ado, I shall now welcome my dad, Mahbub Yaqub, to ask a few questions about OCD. Dr. Saab, is OCD common?
Well, yes, it is fairly common. They say that 1 in 50 people suffer from OCD at some point in their life. People recover from it as well. And it happens in men, in women, in children, teenagers, and there are quite a few people, quite a few famous people who have suffered from it. Sometimes it has helped them with their work as well. For example, there was a very famous pioneering nurse, Florence Nightingale. She had OCD. You may have heard about the famous football player David Beckham. He had it. So it is common.
Is OCD hard to deal with?
Well, it really depends how quickly you are going to seek help for it. But you need help. If you follow the proper treatment plan, you can quite successfully come out of it and stay away from it for the rest of your life.
What are some common causes of OCD?
Well, it really varies. We don't have an exact cause for this, but that much we know that there is a genetic role in it. People who have family members who have OCD, they are more likely to develop it, but that is not the only cause. Sometimes stresses in life, some major life changes, they can actually sort of scratch the surface and bring up the illness itself if it was lying somewhere underneath the surface. So, genetic or family history is important. Major stresses on top of that, major life changes which can be stressful on top of that, and sometimes people develop certain very particular personalities. If people are very organized, meticulous, methodical in their way of life, then they may be likely to develop OCD more commonly as compared to the general population.
What is the biggest thing people get wrong about OCD?
The biggest thing they get wrong is that it cannot be treated. So it should be very clear in everybody's mind, it is a treatable illness. It is essentially a treatable illness. You can completely get rid of it, but that does not mean that the thoughts can be completely wiped off your head. There are some degree of thoughts which many people in general population can have, but they do not amount to OCD or obsessive compulsive disorder. It's that distressing nature and disabling nature of these symptoms. They can be significantly well controlled, and in fact we can get rid of them. So that's what people need to understand, that it is a treatable illness and they must seek treatment for it as soon as possible.
Remember that, guys. Question number 5. In your clinic, how often do patients not know what OCD is?
Well, it's gradually changing, especially in this country where we are living. Even across the world, people are becoming more and more aware of it, partly to do with the internet access of information through Google. So many people do have some degree of understanding, but there are still a large number of people, I would say around half or more than half of people who have OCD, they come to my clinic. They don't know that it could be something like an OCD, so it's fairly common.
How many of your patients that you are currently treating have OCD?
Well, I would say around 1 to 2 people in every 10 people that come to my clinic. So basically, 10 to 20% of people that come to my clinic have OCD.
What are the 3 best coping strategies for OCD?
Number one, go and seek help and get treatment. Number two, go and seek help and get treatment. And number three, go and seek help and get treatment.
Because there's no coping strategies?
Well, they are struggling all their life. They just can't find help elsewhere. They have to seek help. They have to get help and get relief from the symptoms.
Good piece of advice. Would you recommend medications to the younger audience if
Well-
diagnosed with OCD?
Well, it depends. It depends on how bad the symptoms are. The research has told us that if you use therapy, a specialized form of therapy, the cognitive behavioral therapy, and the medication together, the benefit you are getting is going to be much more than if you use any one of them. However, for children, we try to avoid medication as much as possible, unless they are very, very distressed. There are times we have used medication for people under the age of 18. There is no harm in that. They are struggling, they need medication, so we must give them medication. But it depends. We have to assess people individually, and we have to decide whether we should go for the therapy first, and or it's going to be a combination of both, or we can straight away go for the medication. Sometimes it can be hard for younger people or any other people as well to go for therapy, to do that homework you're going to get from therapy can be quite distressing for some people, can be quite tiring, exhausting for some people. So we have to decide on an individual basis. Overall, if it's needed, if you can really justify, there is no harm in giving medication for OCD in younger people.
And finally, how would you like to conclude the video? What do you want to tell the people watching?
Well, people, it's important. Don't delay it. The longer you leave it, generally these conditions can be harder to treat. They can take longer to get out of. That's one bit. So as soon as possible, you are struggling, you must seek help. Number two, the treatment for OCD takes some time, usually around 2 to 3 years. So that's also important. Number three, the family members of the people who have OCD, they must not tell them that you should try harder, because it's hard for them to come out of it themselves. That is why they are struggling. So kindly, family members of people who have OCD, do not give your loved one this advice that you are not trying hard enough. It's better to give them a pat on the shoulder and say, we'll work on it together. Don't give them extra blame for not getting better.
Thank you for all this wonderful professional advice, and thank you guys for watching. If all goes well, anxiety will also be up today.